Internship Portfolio Reflection at Advanced Therapy and Sports Medicine by Megan Peeler. Introduction. Who am I? My name is Megan Peeler. I am a second semester senior and I will graduate in December after I finish all my classes. I play volleyball at Kansas Wesleyan University. My major is exercise health, and this internship was a requirement for my graduation, which was 150 hours, and I chose to do my internship at Advanced Therapy and Sports Medicine. After graduation, I hope to get into cardiac rehab or become an exercise physiologist, which will require me to get certified after I graduate. However, this experience has made me want to consider physical therapy assistant. Primary internship goals. So these are the goals that I created, things that I wanted to learn or things that I wanted to grow about myself through this internship. I wanted to learn more about anatomy, different kinds of injuries and different kinds of surgeries. I wanted to learn the general idea of how a rehab center or clinic works and runs. I wanted to learn how to deal with and assist different kinds of patients. I wanted to take things that I learned in my classes and apply them to my physical therapy internship, because a lot of my classes revolved around a physical therapy setting. For example, my therapeutic modalities class, we learned about various kinds of modalities which are used in a physical therapy setting, like a electrical stimulation machine, which I got to set up on patients several times. I wanted to practice learning professionalism in a workplace and with coworkers, and I hope to achieve these goals through critiquing, feedback, shadowing, observation, questions, and evaluations. Advanced Therapy and Sports Medicine. It is a private practice in Great Bend, Kansas. However, they do have other facilities in Hays, Kansas and Larne, Kansas. It is owned by physical therapist Kevin Sapezi. This is a picture of him right here. He was also my faculty advisor. However, he was not there every day that I worked, so I would also shadow another physical therapist, Dalton, and I would also watch and shadow the physical therapy assistants as well. And this is the logo for Advanced Therapy and Sports Medicine. Duties. These are things that I would just do without being asked. I would just do them when they needed to be done. I would pick up after physical therapists. After they would be done with patients, I would put equipment away and clean off the area that they were working in. I would clean private rooms. The private rooms are secluded rooms that are used for initial evaluations and certain types of therapy, such as manual therapy, and it would also be used for electrical stimulation when a patient would have to maybe take off a piece of their clothing. It's in a private secluded room. And cleaning these, I would clean off the beds that they would be laying on, change the sheet, and change the pillowcases. I would also clean other equipment off after each use, like scrape tools or other chairs or other beds, and other things like that. I would also take care of laundry and trash, which is pretty self-explanatory. The laundry was just towels, sheets, and pillowcases that are used every day throughout physical therapy. Hands-on experiences. I would assist therapists. I would get them equipment that they needed while they were working with patients. They would tell me what they wanted and I would go and get it for them. I would set patients up on their warm-up machines. The warm-up machine catered to their injury. For example, if it was shoulder, I would set them up on the UBC, which is the upper body bike, and it did this motion to warm up this your shoulder and arm muscles. I would also take patients off of the traction table. There's lumbar traction and cervical traction. It's to stretch out the spine for people that were having back problems. I would take them off of that machine. I would set patients up on electrical stimulation, which I previously talked about that I learned in one of my classes at Kansas Wesleyan. So I felt very confident and comfortable setting that up on patients. It was monitored by a physical therapist or I would set it up and then they would come and check to make sure I did everything right. And then I would also take patients off of electrical stimulation once their time was up. I would also set up hot packs and ice packs. The hot packs and ice packs have a certain cloth that they go in to make sure that it's not too hot or too cold. And for elderly patients, they needed multiple layers of cloth because they can't generally handle something that's super hot or super cold. I would walk with patients during walk tests. This was usually with older patients who during the walk test would either walk with or without their cane. And I would be there to make sure they remained stable. I would converse with them and I would make sure that they were doing okay. Sometimes I would get them water because they're not generally used to walking that many laps in a row. And I would also assist with return to play tests. This was usually done with the high school athletes that were coming back from an injury or a surgery. I would set up the tests, record data, and observe. One example is that we had a high schooler who was finally getting ready to return to their sport. So they did return testing for their left shoulder, which they had surgery on. And I learned about different tests that are done, which I also learned about in my advanced exercise testing class. So that was cool to watch them be done for a shoulder because I mostly learned about for legs and hips. I would also assist patients and show them how to do their home workouts and stretches. We give them a little sheet with the workouts and stretches for them to do at home every day. But before we would give them their paper, we would go through with them the exercises and stretches to make sure that they would do it right. And I would generally show them how to do the exercises and how to do the stretches. Shadowing experiences. I would shadow regular therapy sessions, which is just your general lifting weights, the stretching, range of motion activities, and other things like that. I would also shadow initial evaluations, which were my favorite to watch. This would be when we would be getting a new patient. We would do an initial evaluation to test their range of motion, their strength, and other things for that injury. And we would also do other tests. For example, if it was a knee, I got to watch different kinds of tests that are done to test what kind of injury the physical therapist thinks it is. So for a knee, there's various tests you can do, like the Lockman test, or you can do a valgus or varus test to test if it's the LCL or MCL, and other things like that to see where the injury is. And when they test positive for them, then that really pinpoints what their injury is, and it also helps to kind of figure out what needs to be strengthened. The progress evaluations are kind of a midline point where we see how much improvement they have had. We retest their range of motion and strength and other things like that to see how much improvement that they've had. Admin work. This would be work that I would do. I would be assigned it and they would give me a general idea of what they wanted me to do, and I would do it. Home workout and stretching sheets. I actually created this one on this picture. You'll be able to see it in the actual PowerPoint better. This one is for the leg and ankle. So one of the things on here is ankle pumps. It's just where you flex and extend your ankle. This exercise is usually for people with drop foot. Needling assessment form. I created this with another intern. It's an assessment form for needling to see their contradictions or things that mean that they shouldn't have needling. It also asks other questions about if they have had it or other injuries that they've had. And it also is a sheet for the physical therapist to mark what they did in that needling session each time to kind of keep track to see what the patient liked or what they didn't like and other things like that. Patient's medical and injury history. This picture is an example because the one that we have at my internship is on an iPad. So I would generally help older patients who wouldn't know how to work the iPad. I would just ask them the question and I would fill out their answer. It was over their medicine, injuries, their doctors that they've had, the symptoms of their injury, where the injury is, how they think it might have occurred, when the symptoms started, and other things like that to get an idea before they go in for their initial evaluation. Summary: overall, I had a great experience and I would recommend this facility for other people for their internship. Finishing my internship hours was a bittersweet moment. I was excited that I am closer to graduating. I'm closer to that extra step, and getting my internship done means that I will be on track to graduate, hopefully. And it was a little sad because I really felt like I learned a lot and I really enjoyed the work environment, and I'm sad that I won't see the people that I worked with or be in that environment anymore. And I just feel very grateful that I was able to do my internship there. Thank you.